Now, addressing another very important issue here, and this is what is known as a pathogenesis of Helicobacter pylori gastritis. Pathogenesis of Helicobacter pylori gastritis. So it's just what, if I try to define terminology, it just simply has to do with stomach inflammation, and this stomach inflammation is caused by a bacterial infection. This bacteria is known as a Helicobacter pylori. As simple as that, you understand? So it just involves a lot of steps. If you are talking about the pathogenesis, we are basically trying to talk about step by step, how the disease condition actually came about. So first, there's colonization of the gastric mucosa. So Helicobacter pylori, you can see the picture, is usually a spiral shaped non-motile gram-negative bacterium. It has a flagella that usually allows it to now penetrate the gastric mucosal layer, so it will now release some enzymes known as the Urease enzymes. So those ones, they neutralize stomach acid and it creates a protective environment for the bacteria. So the stomach acid that usually destroys a lot of things will have little to no effect on the Helicobacter. Do you understand? So virulence factors, it has Urease, okay, so it will neutralize the stomach acid. It has the vacuolating cytotoxins. It has a cytotoxin associated gene E, okay. So vacuolated cytotoxin causes epithelial damage, okay, and injuries, okay, and a lot of other things. So host immune response is persistent infection will now trigger a lot of inflammations in the stomach for a very long time. All right, that's what is known as a chronic gastritis. So there's release of things that will actually promote this inflammation: interleukin 1 beta, tissue necrosis factor alpha, interleukin 8. So your immune system will be responding, but the inflammation will just be going on, okay. So mucosal damage, so as inflammation goes on for a very long time, it disrupts how the stomach is being protected. So this leads to gastric atrophy. There's risks of peptic ulcers coming up, and of course it can now lead to gastric adenocarcinoma, okay, which is a type of stomach cancer.